Congressman, for a long time, you were a big believer in the Affordable Care Act. You defended that. You still defend it.
Yes.
But you have stated that you believe single payer is the way to go, that we can evolve into that eventually. Is that a fair assessment?
My answer was that I said I think it's probably inevitable because in every other industrialized nation, that's what we've worked on. So,
But
yes.
do you
But I'm
want-
open to what that looks like.
Okay, but do you want that to happen?
Can I answer the question?
Yeah.
Is that the question?
Well, what I want to say is you can answer it this two ways. There are a lot of people who look at the size of government already, whether it's the growth that took place under President Obama, the growth that's taken place under President Trump. They look at the growth that took place under Governor Dayton, that they see the growth of government, they see healthcare, and they worry about turning too much of that over to the government. That yes, they want healthcare to be better, but they worry about turning over too much to the government. Can it be effective? And can the economy handle at the state level and at the federal level government getting significantly bigger?
Yeah, well, multi-pronged questions here. First of all, this nation spends twice as much on healthcare as any other nation, and we rank about 37th in results from that. I simply believe we're better than that. I believe we can achieve outcomes better than anyone else. And there are ways and there's science behind how we do that. But going back to the Affordable Care Act, the ability to make sure that we had people mandated, the idea of an individual mandate, to spread a risk pool across to bring down costs that were skyrocketing. Don't pretend that prior to 2009 that rates were fantastic or they were going down. They were going skyrocketing and we all knew it. So trying to make some containments and trying to work together. We didn't get much help on that, obviously, and we knew that healthcare is a journey, not a destination. We're going to continue to have to improve on that. But here's an example. From 2009 to 2016, in Candiota County, we reduced those that were insured by 50%. And here's what that means. We are never, ever going to, what people want out of healthcare is you don't want to have to use it. That's the thing that you want. If you do, you want it to be accessible, quality, and affordable. And there are things that in healthcare, if we agree on the premise that healthcare is a basic human need or right, we have to be smart about how we're making sure we're incentivizing providers, because the three prongs of healthcare are the person receiving the healthcare, the person delivering the healthcare, and the payer. And so this issue of on this, however this looks, the bulk of our money is being spent here, and we're not getting the results. So if we are ever going to get a handle on this, we're going to have to make sure that people are covered early so they can prevent things that cost a lot of money on the end. And we are going to have to make the case where we are well positioned right here in what we can call Medical Alley, that we're going to have to figure out that the only way to bring down these costs in the long run is to understand what's driving up the costs in the first place. And I challenge all of you to go tell me what it costs to fix a broken arm is. There's no market. There's no price transparency. Once those things happen, we can start to focus on the cost drivers that are driving up healthcare in the first place. We can focus on about 4 or 5 diseases that account for 85% of our spending. And if we do this, we achieve several things. We achieve the moral responsibility to allow people to live a healthy, as happy as life as they can. We keep people working and contributing to our society, and we keep this idea of growth going forward. So the boogeyman of it's government takeover or whatever, how many are Medicare in here? How many use the VA? Yeah. How many expect to be in long-term care? Because in the 1st District of Minnesota, those that are in long-term care, 74.5% of them are on Medicaid. That's the only way to pay for it. So we're missing the argument that we are shuffling around the circle of wrapped around the axle on insurance reform alone, instead of focusing on the things that Minnesota is well positioned with. We have more people covered by insurance, and we are healthier than other states. That gives us a really incredible leap. So to go to this point is, I don't care necessarily what that payer looks like, as long as we're getting value for our dollars, we are improving that care receiver's health, and we are adequately compensating the care providers. That's what we need to figure out together.
So, can I?
Go ahead, Jeff.
Yes. I didn't hear the answer to the question whether you still want Minnesota to be a single-payer state, because